Thank you for joining us for our first campus town hall of the new year. We are pleased to have a panel of experts from the university and community joining us to discuss the latest information on the COVID-19 vaccine. News of the vaccine is encouraging. As we develop our plans, it's important to know that Iowa State University is following the vaccination strategy developed by the Iowa Department of Public Health. The strategy involves a phased approach. It also means that Iowa's vaccine distribution will look different than other states. It is important that we exercise patience throughout this process and that we understand it will likely be several months before the vaccine is widely available to the public. We're about 2 weeks away from the start of the spring semester. We expect the on-campus experience for spring to look similar to the fall. We are very confident in our mitigation plans, building off our successful fall efforts. I am incredibly proud of the university's collective efforts during the fall semester. Across the university, I saw people coming together using innovative thinking and creative problem solving to address challenges, make changes when needed, and show care for each other. I want to thank our public health and emergency operations teams, as well as our faculty and staff across campus for their commitment and tireless efforts to have a successful fall and their ongoing work to prepare for a successful spring. I also want to thank our community partners in Ames and Story County for their great collaboration. As I mentioned, it will be some time before the COVID-19 vaccine is widely available for the general public. Therefore, it is critically important that we remain vigilant and diligent about our mitigation measures, including the cyclone's care behaviors. We also continue to have a very robust testing program, which ramped up again this past week. I deeply appreciate the dedication and coordination of our testing teams. The Thielen Student Health Center, the Veterinary Diagnostic Laboratory, our contact tracers and case investigators. They are doing extraordinary work, and I'm so, again, thankful and proud of the work they're doing. Now, I'd like to introduce the members of our expert panel. Erin Baldwin, Associate Vice President for Student Health and Wellness and Director of Thielen Student Health Center. Kristen Obink, Iowa State University's Acting COVID-19 Public Health Coordinator. David Verhoeven, Assistant Professor of Veterinary Microbiology and Preventive Medicine, member of ISU's Nanovaccine Institute, and a vaccine development expert. And Dr. Dan Fulton, infectious disease specialist with McFarland Clinic here in Ames. Also joining us is Angie Hunt, Director of News Service and part of ISU's Strategic Relations and Communications team. She will serve as moderator today. Thank you all so much for being here this afternoon. Angie, I'll turn it over to you.
Thank you, President Winterstein, and good afternoon, everyone. Before we get started with our panel this afternoon, I do want to remind you of a few housekeeping items that we have. We are using WebEx for today's town hall. The capacity is around 3,000 attendees, so we are hopeful that everyone who wants to participate is able to do so. If you have questions for our panel, you can type those into the Q&A box that you see there on your screen. If you cannot see it, just please hover over or click your cursor at the bottom of the screen, and then you'll see 3 dots. If you click on those 3 dots and then click on the Q&A, the box should appear, and you can begin submitting those questions at any time. Live captioning is available in the multimedia viewer. You'll just need to click continue to see the captioning, and ASL interpretation is also being provided. This session is being recorded and will be available to watch later. We will be posting that on our COVID-19 safety page. So our focus today is really on the science, what we know, what we are still learning about the vaccines that are available, and those still in development. As President Winterstein mentioned, the Iowa Department of Public Health is coordinating the state's vaccination strategy. Erin, I'd like to start with you. The university is following this strategy, so can you talk more about Iowa State's role?
Thanks, Angie. We thought it might be helpful first to start with a snapshot of the timeline that shows the progress that has happened nationally, statewide here in Iowa, and then here locally within Story County and at Iowa State. The Iowa State Public Health Team has been engaged with the conversations surrounding COVID-19 vaccines as soon as they started. So starting in summer of 2020, our public health team continued participating in weekly CDC and IDPH calls with the regular vaccine updates. And then as we move into September 2020, that's when we saw from CDC and IDPH the initial information regarding proposed phasing of the COVID-19 vaccine. We also, at that point in time, gave initial estimates to Story County Public Health regarding our Phase 1A employees. And then we had our vaccine work group that began planning and building technology infrastructure for COVID-19 vaccine distribution. Moving into October, the Thielen Student Health Center was pleased to be approved by the Iowa Department of Public Health as an IRIS COVID-19 vaccination provider site. And Iowa State also secured the ultra-cold freezer storage and transport cooler, so we have the ability to accept the Pfizer vaccine. In November, vaccine planning continued, and then in December, we started to see things happen pretty quickly. So as you likely saw happening on the news, December 11th was when the FDA issued an emergency use authorization for the Pfizer vaccine. December 14th, using recommendations from the Federal Advisory Committee for Immunization Practices, IDPH then finalized their Phase 1A group for initial state vaccine supplies. On the 18th, the FDA issued emergency use authorization for Moderna. And then on December 18th, we also got some first initial doses of vaccine for the Phase 1A ISU employees. In January, things continue to move forward, and on January 8th, that first group of Phase 1A employees received their second dose of the COVID-19 vaccine series. So moving on, we also wanted to give a high-level overview of the vaccine distribution process. So vaccine is distributed to the states. So here in Iowa, our vaccine comes into the Iowa Department of Public Health, who then distributes it to the county public health agencies. The county public health agencies then partner with and distribute to the approved COVID-19 providers. And again, Thielen Student Health Center is an approved COVID-19 vaccination provider, and we're working closely with our partners at Story County Public Health to support vaccine rollout. I think the biggest takeaways that we want everyone to walk away with today is to understand that the vaccine rollout phases are constantly changing, and that Iowa State is part of an overall chain of command. So it's really important that we continue to partner with Story County Public Health and IDPH. Moving on next, it's also important to understand that the vaccine plans are going to look different state to state, and the phasing will look different. Vaccine availability remains scarce, so it's not possible to provide an estimate of when individuals or groups may be able to receive their vaccine. We also realize that our Iowa State employees work and live in different counties across the state. So if you have an opportunity to get the vaccine through your healthcare provider or your county of residence, we want you to take that opportunity. If you meet the criteria of a phase of the plan, we encourage you to get the vaccine where you can. Additionally, we want to encourage everyone to be aware as things continue to change rapidly. There are a lot of vaccine scams out there, and our Iowa State Extension Office put together a great blog on how to be aware of the different things surrounding COVID-19 vaccine scams. And last but not least, Iowa State has stood up a new vaccine website, and that will be a great resource to acquire the most up-to-date information as things continue to change.
All right, thank you, Erin. Kristen, given Iowa Department of Public Health's vaccination strategy, what are some of the expectations for the upcoming spring semester? And will this have an impact on our testing strategy and other mitigation measures?
Thanks, Angie. Those are great questions. So just as Erin said, I thought providing some slides would be helpful for just some visual aids as we go through this information. So, of course, the vaccine is a very important tool in our toolbox, but we continue to have a variety of other things continuing on from fall semester, including our comprehensive testing program. And so I want to go through what that will look like for spring semester here at Iowa State. Our ISU testing site at Johnny's in Hilton reopened this past Monday, January 11th. This is our main campus testing site again. So testing had moved over to Thielen for winter break, but it's now back at Johnny's. Testing at Thielen only occurs as part of a clinic appointment. The hours of operation this semester will be similar for Johnny's, Monday, Tuesday, Thursday, Friday, 8 to 4, and then Wednesdays from 10 to 4. We are closed tomorrow, but beginning on January 23rd, we'll be open on Saturdays from 9 a.m. to noon. Just as in the fall, we'll be continuing to test all faculty, staff, and students who are symptomatic with symptoms of COVID-19, or any individuals who have been potentially exposed and been in close contact with a positive case. And again, just a reminder that that close contact definition is being within 6 feet or less of a positive case for 15 minutes or more. Next slide, please. So going on into some more details around what our spring testing program will look like. New students who are moving into the residence halls and on-campus apartments will need to provide proof of a COVID-19 test before they receive their keys to move in. This will either be a negative test within the past 72 hours or a positive test within the past 90 days as determined by CDC. And then in addition to our new student testing, we are conducting a risk-based sample of students who will be required to test that are living in residence halls or members of a sorority or fraternity. And there were 5,000 students who were selected as part of that sample, and they will be required to schedule a test on or before January 29th. And that sample was collected with a statistically significant sample that we paired up with our statistics team on campus. And so that was a risk-based targeted sample, and those students were chosen based on those sampling techniques. And then in addition to that, we will be continuing with asymptomatic testing through the spring semester based on our campus needs and trends as we closely monitor that data each day, just as we did in the fall. So looking at workplaces, residences, and really looking on campus to identify any issues that we might have early so that we can intervene quickly. And go on to the next slide. And I just want to touch on this as well. It's so important. Certainly we are all very excited that the vaccine has arrived and that we'll be seeing continued rollout of that over the next several months. But it's so important that each of us continues to be diligent and follow our cyclones care behaviors that we know are so important to protect our campus community, just as they were this past fall. So even as the vaccine comes out and we have more tools in our toolbox to help prevent transmission of COVID-19, it will be a long time before our communities here and within our country in general have enough immunity against the virus, either through vaccine or infection, to prevent community spread. And so that's why it's so important, even if you have the opportunity to be vaccinated or have been infected with COVID-19, we still need to follow our face covering guidelines, physically distance, wash our hands frequently, and then of course stay home when you're not feeling well. The vaccine provides hope, but COVID-19 is still present here in our community. And so just as in the fall, we each have to do our part to protect each other. Thank you.
Thank you, Kristen. As you mentioned, it's going to be some time before we have the vaccine here. So Dr. Fulton, even though it will take some time, we know a lot of people have concerns about the vaccine. And what message do you have for those who are questioning whether or not they should get vaccinated?
Yeah, I think those are good concerns to have, and I think any reasonable person should go into thinking about something new with an open mind and some certain degree of skepticism to make sure they're being thoughtful about things. As part of our medical response over here at Mary Greeley and at McFarland Clinic, when things are changing so often, we try to give ourselves some footings of how we would approach this pandemic as it has come upon us and just continues to change over time. And so our 3 rules, you may have heard them. The first rule is don't panic. Second rule is be positive, and the third rule is kindness counts. And we have been trying to kind of apply these rules as we tackle each new facet of this pandemic. And I don't mean to be glib with these. The don't panic rule simply means that as things change, it's easy to become reactive. And I think if we focus on being thoughtful about our decision making, we can often make better decisions than if we made kind of a snap decision. And be positive doesn't mean to take a Pollyanna approach to things. It just means to focus on what is it that you can control, what is it that you can do in terms of encountering this pandemic as it unfolds, and try to take a positive approach to doing what it is that you can do. And I think the third one is maybe the most important, because as we encounter new things, and there's a lot of uncertainty and things don't always make sense or add up depending on the perspective you take, it's really important that we remember to be kind to each other, and that just helps us as we walk through this all together. Next slide, please. So I wanted to share this photo before we talk about coronavirus. This is actually a story about polio, and the young man in the middle there, I guess the boy, is my dad, Mark Fulton. He was at Iowa State in the early 70s and was born here in Ames in 53. And this is a photo of him and his 5 brothers at the time getting their polio vaccine. And at the time, polio was really raging through families in America, and thousands and thousands of children were becoming paralyzed. And this new vaccine came out. So there's a huge demand, a huge interest in getting the vaccine once it became available. And, I think about that notion of uncertainty, and I think about my grandparents who you see there. They were both here at Iowa State in the early 50s. And they had to enter into that unknown, not just with themselves, but with their children. And that takes a lot of courage, but I think they also were able to, ask good questions, have an open mind about what was possible, and then move forward when they thought it was reasonably safe and going to be effective. So this is something that people have encountered before, and it does take a fair amount of courage to move forward. But when you do, it can actually have a profound impact. If we go to the next slide, you can see that polio rates upon the initiation of the polio vaccine plummeted to essentially 0 upon initiation of that vaccine. That was also new at the time. And nowadays, we rarely hear about polio because of the efforts that they took with that vaccine at the time. So if we go to the next slide, when I'm trying to think about how to make decisions under uncertainty, I think you have to just look at the big picture first. So how big is the problem? The problem here is huge. COVID-19 has completely rearranged the way we think about the world and ourselves and our relationships. And so the scope here is enormous. If we had a solution, how would it affect your life if you could get a vaccine that worked really well? Does it affect you personally, and would it affect your community also? And then is the solution that we're proposing, is it, does it work? And how certain are we that it works? And then are there any downsides? Are there any risks? And how certain are we of those risks? And I think we'll be talking more about these vaccines in particular as we move forward. But I do think in terms of a broad framework, that's how I think about vaccines, especially since it's a new type of vaccine for us. If we go to the next slide. So, there's going to be a lot of folks going forward that aren't sure they want to get the vaccine, and I want to say that's totally okay. Right now, we don't have enough vaccine to give everybody anyway. And I think for those that are wanting to think it through, you'll have the added information of lots of people are already getting the vaccine. I got the first round about a month ago. I got my second round last week. And I think we're now having a good sample of millions of people getting vaccinated that we can look at and see how's it working and are there side effects. The good news is that of the 60,000 people in the original trials, 2 different trials that got the vaccine itself, it really didn't seem like there were any severe, high-grade side effects beyond what we might have seen with the placebo. We're going to get more information though on the order of those 1 in a million potential side effects with so many people already getting the vaccine now. And so I would say this has been something we've encountered in the healthcare setting already. There might be people out there that don't want to get the vaccine, and I just strongly urge everybody to just remember the 3rd rule of kindness counts. Everybody has their own way of approaching this. And some people are early adopters of technology and others want to kind of step back and wait and see, and that's all okay. As we move forward and get more information, I think there will be a lot of people that, make a decision that maybe this is okay, even if they were on the fence to begin with. So just extend each other grace as you're going through that process, and you may have colleagues that decide to hold off, and that's okay too. Let's go to the next slide. So, I think one of the most important things for me as a physician is this something that I'd recommend to my family or that I do myself? And, I obviously did it myself. And, my personal experience was I felt fine after the first shot. The second shot, the next day, I would say I had some mild, just kind of flu-like symptoms, felt kind of yucky. I kind of viewed that as a good thing. It's like my immune system was turning on and doing its job. And I think that's been kind of the general consensus around the hospital, is that people actually kind of felt good about knowing their immune system was prepared going forward. And then I would strongly recommend this to my family as well. I just think the extra protection that it can provide, especially in light of such a terrible infection and illness, is definitely worth it. So I think, going forward, we're going to talk more about how the vaccines work exactly, and I'd be happy to answer more questions about that. But I do think this is something that I'd recommend, and I'd encourage everybody to get it once it's available.
All right, thank you, Dr. Fulton. And a wonderful transition to our next question for David. And David, your research has focused on the mRNA vaccines used by Pfizer and Moderna for the COVID-19 vaccine. So what do we know about how these vaccines work?
Thanks, Angie. So one of the things that we get a lot of questions is what exactly is mRNA? So the Pfizer vaccine and the Moderna vaccine are both new class of vaccines that have never been approved before, and they're based on mRNA technology. So most people know what DNA is. So that's your master map that sits back in your nucleus. And the point of the DNA is to eventually make proteins. And most people know what proteins are. But for your cells, they make up the vast majority of your cells, or they do a lot of the work within your cells. But in order to get to protein from DNA, you have to first start with mRNA. So back in the nucleus, the DNA makes mRNA, and that mRNA leaves that nucleus and goes out into your cytoplasm. And then the host machinery starts to make proteins from it. And what's very important to most people to recognize is that once that mRNA leaves that nucleus, it has no ability to go back in and interact with DNA. So it can't integrate back in and cause any changes. Now, one of the unique things about the mRNA is that it is very transient. So they don't last very long. And you have a lot of host proteins and other mechanisms that degrade the mRNA. So it's not going to last for very, very long. So if we go to the next slide. So with the mRNA, it's important to know what's in it. So for the Pfizer and Moderna, you have an RNA that codes for the viral spike protein, and that's that main protein on the outside of that virus that it uses to get into your cells. On top of that, we have salts and we have lipids within the vaccine itself. And those lipids encase the mRNA and help protect it, but also help get it into your cells. And so after they inject it, it floats in, and that lipids will bind to your cells, and the mRNA migrates in, and your cells begin to start making that spike protein from it. Again, no way to get back into the nucleus and integrate and cause any sort of changes to your cells. But eventually, that spike protein floats up onto the surface of your cells and is presented to your immune system. And your immune system will find that, and it invokes a very vigorous response. And from there, we get a great antibody response. So initially, we were expecting a 50% protection rate for these vaccines, and they knocked it out of the park with a 94, 95% efficacy. So that's been fantastic. Now, mRNA, it still went through the typical FDA approval process, all 3 phases, a lot of volunteers that is tested in. And a lot of people are very concerned about how rapid it was approved. And it's just important to know that even though it was rapid in that we went from phase 1 to phase 2 to phase 3 clinical trials really quickly, we still had an awful lot of individuals that were vaccinated. And the data for safety looked very, very good. Now, there are many advantages to these mRNAs, and why they'll probably be some of the vaccines of the future is that you can do very quick development. So for Moderna, for instance, they were able to generate a mRNA vaccine for SARS within 2 days. And that can be very important when we have some of these variants that people are starting to hear about, if we have to make modifications to initiate protection against those. Again, no way to get into your nucleus and change your cells. You can usually use boosters. With these coronavirus vaccines, we're likely to at least be getting a yearly booster with them. And the disadvantages, though, are cost and thermal stability and getting the mRNA into the cells. But the efficacy of these and the broad protections they induce really overweighs a lot of those disadvantages until at least we have some of the other next generation vaccines that come online.
All right, thank you, David. One more question for Dr. Fulton, and then we will start getting to some of the questions from our audience. And Dr. Fulton, we're all encouraged by the vaccine, and we want our lives to start to return back to some sort of normal. But even as people start to get the vaccine, what kind of precautions do they still need to take?
Yeah, those are great questions. I think how fast the pandemic winds down will depend still on a lot of things. It'll depend on how many people end up getting vaccinated. There's this notion of herd immunity, and can we really shut a virus down by as many people as possible getting vaccinated? And I don't know that anybody knows for sure the exact number or percentage of people that need to be vaccinated to achieve that, but it has ranged from 70 to 80%, as I've heard it talked about. So it'll depend on how many people get vaccinated. It'll depend on how quickly the vaccine can be made, and it'll also depend on if there are other vaccines that become available, as was mentioned. And then it'll also depend on, once we get vaccinated, if we continue to have thoughtful and careful behaviors, that will also help the virus go away sooner. And then it also depends on unknown things like how long will the vaccine last once we get it, and what is the effect of different mutations in the virus over time? Could that affect how well the vaccine works? I think we have a lot of reasons to be hopeful about that. People that were in the studies and that are 3 months out from getting their vaccines still had very excellent immune responses. And actually, when we measure the immune system, the amount of immune response after the vaccine is actually higher than the response of people that had actually had COVID virus itself. So I do think the vaccines are going to be providing a long and hopefully quite durable immune response that'll be protective. You can see on this graph, this is the Iowa Department of Public Health graph of infections up through, I think this was the end of December. So we know we had that really bad episode of November when we had so many infections in our state and community. If we could go to the next slide, the goal would be to flip that around. And so instead, we'd be coming out of our high level infections and then slowly coming down. And I anticipate there will still be some bumps in the graph as we go forward, as different populations that maybe haven't yet been vaccinated get exposed to the virus. But I think the goal of the vaccine rollout is to vaccinate the highest risk people first. And so my hope is that even if we see some bumps in the number of infections, that we will not be seeing the associated increase in hospitalizations and death after those vaccinations, the farther out we get. And then eventually, the hope is that if enough people have been vaccinated, that there will simply not be enough traction for that virus to hang around at any meaningful or high level. Again, it'll depend on how long the virus lasts, and I'm not sure anybody knows yet if we'll need to get, another vaccine in the future. But my hope is that over time this will fade away. I think people may be familiar with this Swiss cheese model of trying to prevent an infection. Those viral particles on the left side, they're looking to find a way into the next person to cause the infection. And if people are far apart, they can't get through. If people wash their hands before they touch their face, they can't get through. If people are wearing masks, that decreases the chance of them getting through. But it's really that last slice is where the vaccines come into play and have such an important role. And as was mentioned, these vaccines are so effective, more effective than I think any of us thought they would be, that there's really very few holes in that last slice of cheese. And so the hope is that as the number of infections in the community goes down, that the vaccine alone may be enough to be protected, and eventually we'll get to a point where we don't need to be as physically distant or wearing masks. But we are nowhere near that point yet. We really need to get the numbers down to a minimal level before I think we'll feel comfortable with that. And then I think you'll probably see a phased, sort of a phased drawback of interventions, and during that process, see if there's any rebound of the virus based on behavior changes. And I think, I saw a comment come up just on what I said earlier about being skeptical about vaccines. And I believe vaccines are a really powerful tool to help us fight viruses. And with viruses, they're often our best tool, better than treatments that we have. The prevention is just really such an important key. So when I say be skeptical, what I mean is if you're not sure you want to get the vaccine, take the time to learn about it, but really learn from trustworthy sources, look at the studies yourself, talk to your doctor, find out if this vaccine is right for you. And I think for the grand majority of people, this is a useful tool that, I would strongly recommend to pretty much everybody. We can go to the next slide. So, the summary is keep following those guidance, the Cyclone Cares guidance about washing your hands and wearing a mask, even after you have the vaccine. I've gotten my vaccine now, and I'm still wearing my gear when I'm taking care of people with COVID. And I'm still being cautious about visiting with family. At 95% efficacy, which is how well this vaccine works, the way I think about that is that's potentially a 1 in 20 chance that you could still get the virus even if you've been vaccinated. Well, depending on the risk of a particular person, that 1 in 20 might still be too high. Maybe you've got a family member that has a weak immune system. But if the family member has been vaccinated and you've been vaccinated, all of a sudden that's starting to feel more like 1 in 400. And then if we actually get COVID numbers down in the community and there's very little around, all of a sudden the math starts to add up in a way that we can all start to feel that we're getting finally in front of this COVID infection, so or pandemic rather. So I always say consider your personal risk, consider the activity you're considering doing and how much you value that particular activity. If it's the wedding of your daughter, that's a different thing than, maybe going out to eat for a night. You may value different activities differently, and that'll affect your decision making about what's safe and what's not. So summary is keep taking good care. Hopefully the numbers go down as the vaccine becomes more available, and then we start to, God willing, loosen up after that.
All right. Thank you, Dr. Fulton, and thank you to everyone who has been submitting questions. We're getting a lot of great questions into our Q&A, and we're going to switch to Some questions from our audience. A lot of folks are asking about availability on campus. So first, I just want to remind everyone what Aaron Baldwin shared with us earlier, and the fact that because of the scarcity of the vaccine, changing guidelines, it's really not possible to provide an estimate of when certain individuals or groups may be able to receive their vaccine at this time. Another question we're seeing a lot from our audience is about variants. David, maybe we could ask you about this one. As far as some of the different variants we're seeing, is it possible that this could become, some of these could become a predominant strain in the US by March?
So yes, what we have two main variants right now. One is what we call the UK or B.1.1.7 strain. And what's important to know about those is they spread from person to person a lot easier, but they're not necessarily more infectious. Now, Moderna and Pfizer have already tested their vaccines serum against the UK version, and they saw that it does in fact neutralize. So it's likely that's going to protect those vaccines. Now, the South African version that is now spread up into Africa, Australia, and Japan, that's one that the NIH is very, very concerned about. So that has 3 mutations within it. And we're very concerned that those 3 mutations may confer some resistance, whether it's partial or complete resistance, to the antibodies that your Moderna and Pfizer have, the antibodies that it elicits. Now, that said, Moderna and Pfizer are already making plans to include additional mRNA transcripts that should cover the South African strain if our abatement strategies fail to contain that.
All right, thank you, David. Shifting gears back to our testing strategy for spring. Aaron or Kristen, I'll throw this out to both of you. A couple of questions related. One, why aren't we testing some of the students that, or all students that live off campus too? And how is the requirement for the asymptomatic testing going to be enforced?
Sure, I'm happy to take those, Angie. Thank you. Regarding your first question about why are we not testing everyone who's coming back to campus, so I want to provide some more information around how our testing strategy was designed. Our existing students who live within our on-campus residences and apartments, first off, they're very familiar already with the expectations that we have for our campus community regarding the cyclone's care behaviors and how important those mitigation strategies are. And so one reason we wanted to be sure and test our new students is to provide them with that same set of expectations. Also, we're communicating with them very closely to make sure that they understand, being new to our campus community, just how important those cyclone care behaviors are and those mitigation strategies that we expect everybody to participate in and uphold. Another thing I want to discuss is that sample of 5,000 students that I talked about earlier. We have the advantage now that we've had a successful semester in the fall. And so we can look back at that and look at our data and some of the areas where we know there was a little higher risk present, and some of the things we know that we can do to try to prevent transmission of the virus and target that a little bit better. And so in partnership, as I said, with our statistics team, we're able to provide this targeted sampling strategy to identify asymptomatic individuals. It's a similar goal to what we had in the fall, and try to isolate those individuals quickly and prevent transmission of COVID-19 within our campus community. So that approach, people could look at it similar to our lead move-in testing that we had in the fall, where we were doing the same. We were trying to identify asymptomatic individuals and isolate them quickly to prevent spread. But here we're able to do that with more information because we have that semester behind us. We've learned a lot and we have a lot of data to base those decisions on. And then your second question, remind me again, so I can make sure I address that appropriately.
Certainly, and I think you touched on both of them. They wanted to know how the requirement would be enforced and why we weren't testing all the students, so the enforcement piece.
Yeah, so I'll just add on to that briefly. We're communicating very closely with students so that we don't even have to come to that point of enforcement. We're trying to empower people with the information they need to make that decision to protect themselves in our campus by going to get tested. And that includes working closely with our Department of Residence and our sorority and fraternity engagement office, and really making it known why it's so important to get tested, so that people are willing to go and do that. And we have seen a very high response rate even in just the couple of days that information has been out there in our campus population.
Thanks, Kristen. Dr. Fulton, next question for you. The national news media and UCI Health in California is today recommending not to take pain relievers such as Tylenol or ibuprofen prior to taking the vaccine. Would this be your recommendation?
Yeah, I think so. I wouldn't take those medicines preemptively. When we look at side effects of the vaccine, it's the grand majority of people don't have any meaningful side effects. Maybe they get a little bit of a sore arm. But in terms of side effects like fevers or nausea or headaches or things that would really keep you home from work for a day or two, that especially with the first vaccine, of the series, that's really uncommon. And I don't know that anybody knows for sure if blunting the fever or immune response would affect how well the vaccines work. But I think not knowing that for sure and knowing that most people do fine with the vaccines, I probably wouldn't have anybody take Tylenol or ibuprofen ahead of time. On the back end, let's say you get your vaccine and you feel terrible afterwards, which again isn't common, but if you did, then yeah, you can take some Tylenol and just try to take the edge off a low-grade fever or a headache. I think by the time you get to that point, the immune process is happening, and so you're not going to, limit it or make it not work. But I probably wouldn't do it preemptively. So yes, summary, I would agree with that.
A related question for you, Dr. Fulton. You spoke earlier about your response to the vaccine, and someone was wondering about the duration of your symptoms of what you felt.
Oh yeah, and I can speak to all of our nurses here that I've been speaking with for the past couple of weeks. It really seems to me like when people did have side effects after the second vaccine, in particular, that it was the next day. It was some mild flu-like symptoms, maybe some low-grade fevers and chills, and some headache. And then by the following day, the grand majority of people have felt totally fine. So it's kind of a 24-hour process to get through it. On the other hand, I've had people come to me after their second vaccine with a sense of anxiety because they felt totally fine and they wanted to make sure it had worked. And yes, it does work. You don't have to get side effects to know that it's working. That it's sort of designed to try and have you not get side effects, actually. So I have not heard any stories of any really long-lasting side effects. I heard of one nurse that had some symptoms on a second day, but was able to come to work despite those symptoms. And for me, I didn't have to work the day after my vaccine, but if I would have had to, I could have. So, and everybody's different, but yeah, about 24-hour kind of mild flu bug.
All right, thank you. David, another question for you. Can you please comment on the person who received 2 vaccine shots? I think people may be hearing about this in the news media, then tested positive to COVID. Is it possible for the vaccine to give a positive response?
So for the vaccine, it's important to know that we know from some of the smaller studies that have been done thus far and some of the early primate studies that some individuals can still carry the virus in the nasal passage, but you're protected from disease. And with the current way that we're testing, if we're scrubbing into the nasal passages, you may still detect virus. And our concern there is it's still possible that some individuals might still be able to shed that virus. And so that's why they're still, one of the reasons they're still advocating, even if you get the vaccine, they still want you in mask until much more people can get that vaccine.
Somewhat related, another question coming in. After being fully immunized, could people still be a carrier of the virus? Is that something we know?
So you can carry it potentially in your nasal tract. But again, those studies are very, very early. And it's not a lot of individuals. The vast majority, it looks like, they get complete protection from the virus, but it appears that there may be some individuals that are able to still get infection in the nose, but they won't get disease, and they're able to spread that.
This is Dan Fulton, and just to be really clear, the vaccine, the current mRNA vaccines are not living things. They're little bits of genetic material. So people do not get coronavirus from the vaccine. It's just not possible. It's not a living thing. So if somebody gets diagnosed with coronavirus shortly after getting their vaccine, we're talking about millions of people, so it's going to happen sometimes, just coincidentally. That means that probably that person had already contracted, the virus before they got their vaccine. And then it was a coincidence that their symptoms started shortly after the vaccine was given.
Or
But
alternatively,
you can still get coronavirus potentially, very unlikely, but potentially even after the vaccine, which is why we still recommend taking these precautions.
right, so it's got a 95% efficacy, so there's still 5% of people that can still get it.
All right, thank you both. Scrolling down to our next question. Erin, if you could talk a little bit about the students that are part of the risk-based sampling, how are they being notified?
Yeah, happy to answer that question, Angie. So our students received messages earlier this week. They got both an email and then text messages were sent as well. And then I know the Department of Residence and Sorority and Fraternity Engagement are assisting with the communications with our students that are part of the selected sampling testing as well.
Thank you. Dr. Fulton, can you talk about vaccination for those who are under 18 years old?
Yes. The Pfizer vaccine is approved for people down to 16 years old. The Moderna is approved for 18 and older. The studies were done in people that were 18 and older, but for various reasons, for the Pfizer approval, they said 16 and older would be fine. Both of these companies are engaging in studies now down to 12 years old. And, based on how the vaccines work, I really feel that by the time we get these studies back, we'll find that they're fine to be given in pediatric populations. At the moment, since fortunately this virus does not seem to affect children with near the severity as it affects older adults, focusing on older adult populations with the vaccination strategy first makes sense. And then I think over time, the pediatric data will emerge and we'll find out that it's safe. Along those lines, I think there's a question about, breastfeeding and pregnancy as well. That's come up a lot of times in our organization. And there are different approaches here. In the UK, they've recommended against pregnant or breastfeeding women to get the vaccine because they simply weren't studied as part of the original trials. The United States, on the other hand, has said that's a decision that we will leave up to women to make based on their own health and values. As I look at it, and what I've counseled people is, I cannot think of a conceivable way that this vaccine could harm a breastfeeding baby, period. I just cannot imagine how that would work. And if anything, it may actually protect baby through passive transfer of antibody in breast milk. So my wife is breastfeeding. I recommended she get the vaccine as a physical therapist at the hospital, and she's gotten it. I think the pregnancy question is a little bit tougher, just because we take such extra care with a developing fetus. Again, I can't think of any way that this would affect a developing baby in terms of a mechanism. Certainly people get virus infections while pregnant, and we haven't seen that the immune response to the virus seems to affect the growing fetus in any unexpected way. But definitely the risk to a pregnant mom who gets COVID is very high, 5 times higher than the general population. So what I've counseled pregnant women is to look at their personal risk for what their risk would be to actually get COVID. And if it's high based on their work or their potential exposures, then it's not unreasonable to go forward with the vaccine. On the other hand, if they really don't have a lot of COVID exposure and otherwise feel that they can kind of have a cocoon of protection otherwise, it may make sense to wait until we get more data. There's a lot of pregnant women getting this vaccine, and I think we're going to find out in the next couple of months if there's any safety concerns at all.
Dr. Fulton, I'm going to stick with you for another quick question here, because you touched on these two questions in your previous comments, but we've seen a lot of estimates out there about herd immunity. Do we have a feeling of just how many people need to get vaccinated to reach that? And then a second part to that question, how might you suggest we talk to people who are hesitant to get the vaccine?
You know, I think what percent of the population needs to have either had the infection or been vaccinated depends on how contagious the virus is. Which is why this UK variant that is more contagious has caught our attention, and people may have noticed that the estimates for herd immunity have gone up. You know, initially they were saying 60 to 70, now they're saying 70 to 80. Part of that has to do with just how contagious the virus is. And if a more contagious variant has emerged, then, you know, the number of people that needs to be vaccinated goes up. You know, in terms of how to talk to people that are hesitant about this, I think vaccine hesitant people often get lumped in with, you know, people that absolutely will never get a vaccine ever. And, you know, we don't need to argue about this right now. I think there's a lot of things that people already argue about. And I just think that if we can be encouraging to people to ask good questions, to try and understand what their values are and what concerns they might have, and, you know, to dispel myths about the vaccine as well. You know, those are all important things. I think at the end of the day, you know, talking to people and being open with them and sharing your own experiences is really important. And don't assume that just because somebody hasn't gotten other vaccines that they won't get this one. They may have different perspectives about this one.
Thank you. Next question for you, Erin. Someone writes, they have friends who are collegiate faculty in other states that have already received the vaccine. Why are we so far behind in Iowa?
Yeah, great question. So vaccine is definitely being distributed to different states differently. So, and phases look different. So again, IDPH is trying to take the vaccine that's being allocated to the state and then distribute it based on what they have from the data. So the rollout phases are going to continue to change rapidly, and we're going to likely continue to see a lot of differences between the states and how rollout is happening. So we're hopeful that, you know, there's a lot of good things on the horizon. There's some other vaccines in development that are close to emergency use authorization. So we're hopeful that there will be more vaccine on the market and we can continue to have more availability soon.
And then one other question for you, Erin, before you pop off there. How will the university reduce or eliminate student participation this spring in large events, parties, other super spreader type events?
Well, we have, again, we want to circle back to our cyclone scare behaviors and really call upon our students to really take those into consideration and be cautious in what they do. You know, there's a lot of great information out there. We know that a lot of our transmission happens in those risky situations. So just imploring upon our community to follow the cyclone scare behaviors and do what they can to prevent spread.
Thank you. Last Friday, the ISU community and Story County community had an opportunity to participate in free asymptomatic testing with Corteva. And maybe Kristen, could you talk a little bit about the outcome of these test results and those who were able to take advantage of this opportunity?
Yeah, I can. So we had a good turnout. We had over 900 people come in to test. Now that isn't just specific to our ISU community, although our ISU community certainly did make up the majority of that population, but we had others from the Ames community participate in that as well. So thank you to those who did participate in that. The positivity percentage for that was just over 3% for that entire group. And so that is about what we expected based on, of course, these are asymptomatic individuals that are coming to test. So that's important to keep in mind. It's a different population of people than we're typically testing at our Iowa State testing. So the Corteva testing was separate from our Iowa State testing, but Of course, our Iowa State testing generally focuses on our symptomatic and close contacts. So those people would be at higher risk than our asymptomatic population. But we were pleased with how much participation we had and appreciated the partnership to Corteva and the tests that were done there.
Thanks, Kristen. David, another question for you. Is there any evidence of the coronavirus variants developing the ability to evade the current testing methods that we have?
So we know that the UK version, with its one amino acid and slight deletion, the antibodies neutralize that one. With the South African, it has not been fully tested yet, but with the 3 changes, important changes with that virus, there is a significant concern that it will be able to at least partially, if not fully, avoid the induced antibodies that the vaccines make.
Thank you. We're getting close here to the top of the hour. I'm going to try to get in one additional question. Erin, could you go back to your initial question in the presentation you made? We're still getting a lot of questions about some of the phases. And just kind of recap for folks how the state is rolling out the vaccination program here in Iowa.
Certainly. So again, the Iowa Department of Public Health is establishing the definitions of the phases, and those are constantly changing. I can tell you, for example, phase 1B has changed multiple times in the last couple of weeks. So I think we have to just continue to stay connected with what is happening there, and they're making decisions and trying to change to put forth the best strategy for the state. So, you know, it's not Iowa State making our own plan. It's not Story County making our own independent plan. We're part of an overall phasing process and just have to know that things will continue to change, and then we'll provide information as soon as it's available, because the great thing is so many people are interested in getting the vaccine, and that's a positive thing, and we're excited about that.
All right, thank you, Erin. And I think with that, we are going to wrap up our Q&A portion of our town hall this afternoon. Thank you to all of our panelists, and thank you to all who submitted questions. We will be capturing those and working to provide additional information to those who didn't get their questions answered. So again, thank you. And with that, I will turn it back over to President Winterstein.
Angie, thanks. You did a great job as our moderator today, and I'll just add my thanks to yours, to all of our panelists. A special thank you to Dr. Fulton for joining us today from McFarland Clinic. I want to also remind the audience that if your question was not answered, you can submit it to the covid-19@iastate.edu address, and we'll get it directed to the right unit or department for an answer. Please also remember that our COVID-19 updates and resources webpage is the central source for the most up-to-date news and information about Iowa State's COVID-19 response. Please bookmark this page and check it often. We will post a recording of today's town hall on that page by early next week. Inside Iowa State is also an important resource for weekly news and information. Finally, we all know this has been an incredibly challenging year, and the challenges are going to continue as we head into the new year. I encourage all of you to prioritize your health and wellness and to make time for self-care. We invite you to attend a virtual event next Tuesday, January 19th, on managing emotions in the pandemic. University Human Resources and ISU Wellbeing are coordinating this wellness event for faculty and staff. You can find more information on the University Human Resources Work Life webpage. Again, thank you all for joining us this afternoon. Have a great weekend. Thank you again.